Hi everybody, we want to start pharmacology for the NAPLEX exam and the USMLE exam, and I start first lecture in the pharmacology with the review of the therapeutics, and we will speak about 5-alpha reductase inhibitors. I hope it will be nice and good, and it will be very useful for us. 5-alpha reductase inhibitors are the group of the medicine which is the block the action of the 5-alpha reductase enzyme. As you know, because 5-alpha reductase enzyme, it is an enzyme. It has a 3 type of the isoenzyme, type 1, 2, and 3. And this enzyme converts testosterone to dihydrotestosterone. With the 5-alpha reductase inhibitors, we can block the action of the 5-alpha reductase. In this situation, the testosterone cannot convert to the dihydrotestosterone, and the level of the testosterone will be higher, increased, and the level of the dihydrotestosterone will be decreased, and the level of testosterone in the blood increasing. As you know, dihydrotestosterone can cause a benign prostate hyperplasia. It can cause increase the size of the prostate gland, and in the situation the urination can be problem in the male, and also without prevention it can cause prostate cancer in the future. And in this situation the patient will have a problem in the urination, frequent urination in the night, and sometimes a pain in the urination. And the second time, sometimes in the second situation we can use for prostate cancer. We will study the cancer types, because we cannot mention which type of the prostate cancer can be treated with the 5-alpha reductase inhibitor, but in the future we will study in the cancer parts, because the type of the cancer, it is depend for the type of the cancers. And other treatment types, and the third one is androgenic alopecia, or baldness of the male, mainly for the male, because of this dihydrotestosterone can cause baldness also. Usually we use for this situation from the finasteride. Enzyme classification, as I say for you, for the 5-alpha reductase enzyme inhibitors, we usually use type A. We usually use for the type 1 and 2. But there is a type 3, but these enzymes mainly cannot affect it. 5-alpha reductase inhibitor types, first is the finasteride and dutasteride. Finasteride inhibits the type 2 only, and dutasteride inhibits type 1 and 2. Dutasteride, higher suppression of the dihydrotestosterone, it is more active and more stronger. We can use finasteride for example, for the baldness, but dutasteride mainly we use for the hyperplasia of the prostate, benign hyperplasia of the prostate. Enzyme, and also 5-alpha reductase inhibitor structure, as you see, both of them has 4 rings, 3 cyclohexane and 1 cyclopentane. In the carbon number 4, nitrogen is replaced. As you see in this structure, both of them has a nitrogen in the number 4, and we have a 4 azo group. And it is the analog of the testosterone, because the same, but just in the nitrogen different. And they are competitive with the testosterone and selective inhibitor. But as you see in the left picture, it is a finasteride. The groups bind for the carbon number 17 has a amide group. Both of them has the amide group, which here we have a third butyl bind for the nitrogen, but here we have a big hydrophobic groups, and because of this group is very it causes high potence of the dutasteride. Common side effect of both of these drugs: decrease interesting in the sex, because as you know the dihydrotestosterone decreasing. As you know, it can cause effect in the intercourse and the interest in the sex, and abnormality in the ejaculation. Sometimes the ejaculation stops, and sometimes it takes a longer ejaculation, and because of the usually in the 90% of the ejaculation, it is a abnormality in ejaculation. It is the ejaculation stops and doesn't works. But in some persons, maybe it is opposite, and the ejaculation will be higher, and for long times. And in orgasm, sometimes the painful orgasm, sometimes the orgasm can never be happen, and sometimes the ejaculation and orgasm, both of them is stopping, and sometimes the premature ejaculation also happen in this situation. Impotence also can be one of the causes of these drugs. Dosage and combination. Usually for the androgenetic alopecia or for the baldness, we usually use finasteride with 1 milligram orally once a day, because it is a tablet. It is effective. If we and in both, very usually we can use from this medicine. For the benign prostatic hyperplasia, we use both of the finasteride and dutasteride. And the finasteride we use 5 milligram orally once a day, and from the dutasteride we use a 0.5 milligram orally once a day. But for the androgenic alopecia, we don't use a dutasteride, as I said, because of the high potency, and also because of the side effects. Dutasteride can be used in the combination with the tamsulosin, and the name of the drug is the Gelane Pro. Dosage form finasteride usually is a tablet, and it is orally. And the drug medicine name is the Propecia. It is 1 milligram, and the Proscar is 5 milligram. And the generic, also we have other generics, 1 milligram and 5 milligram. And from the dutasteride, it's a capsule usually orally. Then we have a Ovadart, is a half milligram, and we have other generic with a 0.5 milligram. In the metabolism, both of these drugs metabolize in the liver. Finasteride hepatic enzyme CYP3A4 metabolized finasteride for 2 active metabolites. Okay, and these active metabolites are weaker compared to the finasteride. But in the dutasteride hepatic, CYP3A4 and CYP3A5 isoenzymes can metabolize to dutasteride for 3 active metabolites. Okay, which includes 6-hydroxy dutasteride, has a higher activity, or we can say a similar activity to the potent, or for the same of the dutasteride, and 4-hydroxy dutasteride and 1,2-dihydroxy hydrodutasteride, much less potent compared to the dutasteride, and very less reactive. Excretion is very important. Usually for the excretion, finasteride 57% of the fees, because of this liver metabolized, and it can be from the bile portal system, comes to the bile duct, and from the bile duct to the intestine, and also in the urine 39% as a metabolites. But dutasteride in 40% as in the feces as a metabolite, and 5% is unchanged drug, because also for the both of them, because it is orally used, for the absorption is different, and in dutasteride absorption is a little lower, and 5% of this unchanged drug goes out from the feces. But in the urine, 1%, less than 1% is without changing, unchanged drugs, and 55% is the metabolite. 3 types of the metabolite, which we saw in the last page. Warning and the precaution. As I spoke before, because metabolites happen in the liver and excretion by the kidney, liver problem and hepatitis and the liver disease, it is the first warning about this medicine. And also kidney failure can, because of the excretion, can be happen and can be decreased. And those must be monitored in this situation. We have to pay attention for the liver disease and hepatic impairment, and it is one of the important things because of these problems. Sometimes because it can cause hepatic impairment because if we have a liver disease. But also the other problem I said in the first page is the prostate cancer. I said before, because prostate cancer can be caused with a different type of the mechanism. Okay, it can be because of the estradiol effect or different type of the cancer, and we will study in the future. And in some of them we cannot use 5-alpha reductase enzymes because it can cause opposite effect and worse effect, and kidney failure because I said in the excretion of these metabolites and these enzymes, because it's very important. Some persons can be allergic reaction. Okay, so for example the rash or headache or something worse when the person get first dose, and in this situation this person cannot use because of the allergic reaction from this medicine. And if they have this type of the problem, for example hyperplasia and baldness, he can use or she can use other type of the medicine. And the other problem we saw in the metabolism, CYP3A4 inhibitors we will study later. Okay, some of the antibiotics and affecting the CYP3A4 or some of the medicine also, some of the fruit. We have to speak with our doctor about these drugs interactions. And I hope this lecture will be nice and have a good time.